My name is Fred Trotter. I'm a healthcare data journalist with CareSet. So we are concerned with, we really don't write stories as much as we gather data from federal sources and other people to help other people write. But in this case, we are acting as more traditional journalists, video journalists for a second, and we're helping Healthcare Datapalooza, the conference, with their streaming booth.
Okay.
So we have some real high-level questions that we'd like to ask you, and you can take the conversation in any direction you'd like. Top level, what brings you to Healthcare Datapalooza?
Truthfully, all of my friends here, I've been, I know Niall very well, Dr. Cohen with my work at CDC, and a lot of our colleagues are here. But, when I'm in the hallways, it's absolutely incredible how many other faces I'm seeing. And so, it's been really fun. It's been fun to hear what everyone's been up to. Data, I feel like, is moving 2,000 miles per hour. Data is the new oil. And so it's a really exciting conversations to be a part of.
But just to riff on what you've just said, do you feel like data is the new oil, even in the era of AI?
Oh, yeah. I mean, because AI needs some sort of closed circuit system to work off of. And part of that is data, whether it's words or numbers. We are still need to feed AI and how to think. And so, yeah, I mean, I use AI all the time in my day job as a tool, but not necessarily AI couldn't do my job, at least not yet. I guess I'll knock on wood.
Well, I think about all the time. I keep secret notes for myself now. That is the things that I know that AI might get wrong. So, for that long plan for your career, I think we'll probably all start doing that.
Yeah.
Are there specific healthcare data sets that you're interested in here at Datapalooza? I know you are an epidemiologist. You are a professor at the School of Public Health at Yale, and you advise, seems like, in a lot of plaplaces. Is there a specific data set that you're particularly excited about? I mean, it seems like you're interested in everything.
Yeah, what I bring to the table is translating data into understandable terms and plain language. As an epidemiologist, I'll tell you, though, I am so excited about the potential for wastewater data surveillance. It's not every day we get an entire new surveillance system of data. And this is what our gift during the pandemic was, a silver lining of wastewater surveillance. And it's incredibly powerful because it takes away a lot of biases we see in testing or hospitals. And it represents 85-90% of the U.S. population in an area. And that's really powerful. I think we're in a new frontier with it. We're trying to understand how to use it with other things other than COVID or flu or RSV. So, for example, with opioids or dengue, the opportunities are endless. And so I think that's what I'm most excited about.
That's incredibly cool. We were just talking about exactly the same thing in a previous video. And of course, if you're watching, you should watch all the videos, of course. But I think the EPA was kind of the first to figure out that you might not be able to figure out what an engine is doing. But if you could get a measurement device right at the exhaust of the engine, you could figure out whether or not pollution was happening at other times too. So I think having downstream data sets, exhaust data sets, the idea that you can't measure the thing you want to necessarily, but you can measure something that's close to it, that if you look in a different place, I think that's an exciting approach generally.
Yeah, I like the concept and analogy of the exhaust pipe. With wastewater, it's upstream. It's actually a tool that happens to increase uptakes before we even see cases or hospitalizations increasing. So it gives us even more days and buffer room for a response, and we could use all the hours and minutes we can. So yeah, it's an exciting time, and we'll see where it takes us.
It's really interesting. And of course, the metaphor of a stream is a little bit weird when you're talking about wastewater because it is like literally a stream. But yeah, it happens before you go to the hospital. So it is upstream to that process. Downstream. Anyways, I'll just leave it there. What are potential recent healthcare data policy or technical changes that you're excited about? A lot of things have been happening with interoperability. Is that something you pay attention to?
Yeah, and it's something I'm helping advise at the CDC is, public health. I don't know if everyone knows, but public health is this incredibly fragmented, decentralized system in the United States, and we saw that really come to fruition during the COVID-19 pandemic. Some of that is because of our laws, but I think there's solutions out there in data, and I'm super excited and pumped about data modernization and figuring out how to connect all of these fragmented pieces, and not just public health departments, but then how do we then plug in healthcare, and how do we then plug in nursing homes and schools, and to get a really comprehensive picture of what is going on out there. And the better we can measure it, the better we can help support people on the ground to make evidence-based decisions. So I'm really excited about the infrastructure. It's not really sexy, but it's certainly beyond time we get past fax machines and start really creating data exchanges and data flows from place to place and from person to person.
Yeah. So for our patient audience, there's a lot of patients at home. In fact, the reason we're doing this is so that people who can't be here because of a healthcare condition have a way to interact with the experts like yourself.
Oh, cool.
And so
Okay.
this is, in fact, this whole effort is to try to make the conference more accessible. And one of the things that I think patients don't understand when they talk about the CDC is that our Constitution reserves to the states public health powers. And so that you kind of hinted at that underlying problem, but that's something that if you're a policy wonk, you're a healthcare policy wonk, oh yeah, I knew that. I knew that before the pandemic. I knew that last time there was a problem with the bird flu or whatever it was. So many of us are aware of that detail that I think patients look at the CDC and think, well, why didn't they? Yeah. In many cases, the answer to why didn't they is because they don't actually have that power. I think the other thing people don't understand about the centers for disease is that that's a plural word. It's the centers, right? It's inherently fragmented. There's inherently different things going on. And I know you serve as an advisor to them, and them could mean the people, but also the centers, more than one center. So thank you for helping with that.
Yeah, I will say also a lot of people don't realize that even within states, some states is even decentralized. So I was an epidemiologist in Texas during the height of the pandemic, and within Texas, it's decentralized. And so you can imagine that this network of local, state, and then national public health is a puzzle piece. And we need to figure out how to get those puzzle pieces more aligned quicker and better during peacetime, so we are ready for big emergencies like COVID-19 or Mpox or H5 or you name it.
So you've had a session, you were on stage. Is there anything from your session that you feel like was really, you would like somebody to say again or react to here?
I think my take-home message from my session was that we often neglect the last mile in the data journey, which is data to action. Making sure our data is translated, it's usable, it's timely, it's accessible, so people can make evidence-based decisions today, not in 9 months once that publication is released. And this is a huge gap. And there's certainly not enough people focusing on it or resources for it. And so I've been trying to shout from the rooftops of this need, because then people feel lost or at worst mistrust the CDC because we're not explaining it well. And we really need to bring people along for the scientific discovery ride.
It's so difficult. I think sometimes we felt like we were trying to steer by looking through the rearview mirror during the pandemic for a lot of data delays. And I think in some senses, it's interesting. You are an epidemiologist. I think that profession is going to change profoundly, because epidemiology is one of these fascinating expertise, because you sometimes act like detectives and you sometimes act like statisticians and you sometimes act like public health people. And, you have all of these different things. It's really fascinating. Thank you for talking to us. I really appreciate it.
Yeah. Thank you for having me.
And let's talk more.
Okay.
sometime.
Thank you for having me.